It's summertime. When the temperature is hotter, the days are longer, and gun violence in the United States tends to increase. Gun violence remains one of America's most pressing and arguably most American issues, with significantly more people dying of gun-related causes here than in any other high-income country. Gun violence is also a famously politicized issue in the United States, and depending on who you talk to, it might boil down to socioeconomic conditions, to mental health, to gun access, or perhaps to insufficient criminal penalties. But through the back and forth, the statistics remain clear. In the United States, guns are still the leading cause of death for children. They're the weapons used most often in domestic violence against women, including murders of women who are pregnant, with homicide being the leading cause of death for pregnant women. And guns are also used in 55% of suicides in the U.S., with suicides accounting for more than half, 58%, of all gun-related deaths in this country. So, how much progress have we made on reducing gun violence? What do we still need to do? And how can we actually cut through the noise to do it? I'm discussing this today with two of our experts at the Baker Institute. Dr. Sandra McKay is our Child Health Policy Fellow and Director of our Firearms Injury Prevention and Safety Program, as well as a general pediatrician and associate professor at UT Health Houston. Dr. Eric Fleegler is our new non-resident fellow, as well as a pediatric emergency physician at Massachusetts General Hospital and an associate professor of pediatrics and emergency medicine at Harvard Medical School. I'm David Satterfield, director of Rice University's Baker Institute for Public Policy in Houston, Texas, and this is Baker Briefing. Sandy, Eric, thank you very much for joining me today. You both approach the issue of gun violence from the perspective of health practitioners. Sandy, you've also discussed being a gun owner, as roughly 1 in 3 Americans are. For both of you, how have those vantage points informed the work that you do and how you envision solutions to the gun violence problem? Sandy, you want to start?
Thank you so much for having us today. I think being a pediatrician, a lot of what I do as an outpatient general pediatrician is identifying people who are at risk for firearm injury and seeing what I can do to help reduce and mitigate that risk. Being a firearm owner also allows me to connect with my patients and connect with them and say, we all have to be responsible firearm owners together in order to help children not be at risk for injury, especially when it comes to unintentional injury, when it comes to suicide prevention, especially with those who are at risk, and working collaboratively to, as you said, cut through the noise and cut through the politics, because we all have the same shared goal, which is no one wants to see a child die by a firearm.
Eric?
Thank you so much for having us today. As you said, the extent of firearm violence in our country is actually quite shocking when you dive into the numbers. And I just want to emphasize a little bit of what you already said. So about 48,000 people are dying every single year in our country from gun violence, and another 250,000 people are being injured by guns, which literally amounts to billions in dollars of medical costs per year. And when we talk about guns being the leading killer of children, which is ages 1 to 19, it's greater than motor vehicle crashes. And if you took every single infectious, cardiac, congenital, you name it, medical cause of fatalities of children, added them together, firearms are more than double that. So, it is a huge problem. With regards to how we're doing, the answer is not well. These numbers have been on the rise for more than a decade. And, the solutions that are going to take to reduce these are ones that we're trying to understand, we're trying to study and trying to implement. And in pockets, we're seeing progress. Unfortunately, we're starting to slip back, and it's a huge problem that we're not even close to solving.
If you want to contrast over this last 10 years, and Eric, I'll follow with you, homicides, suicides, accidental deaths as a result of firearms, what are the trend lines? Up on all cases?
The answer is yes. So I've been doing research in this area for about 13 years. When I started doing research and looking at the first decade of this millennium, we were seeing roughly 30,000 people dying a year. And it was pretty consistent, and it worked out to about 10 per 100,000. Currently, at the number of 48,000 people dying a year, we're about 14 per 100,000. So we've had roughly a 40% rise in fatalities. The gun violence, in terms of the disparities, has continued to grow. When we look at young Black males versus versus young white males, they are dying at 24 times the rate when it comes to firearm homicide. With regards to suicide and homicide, as you've already said, suicides are actually the leading cause when it comes to firearm deaths, why they're dying. And those have been pretty consistent over time. But what we've seen, and especially with the pandemic timeframe, we saw both a huge leap in homicides and suicides. What's interesting when it comes in particular to suicides, and in particular suicides among youth, these are entirely preventable types of deaths. They are 100% deaths of access. Access in the setting of either depression, mental health problems are a huge issue, but actually, when it comes to youth, a lot of suicides are not depression related as we typically think, but situational. That bad grade on a test, the breakup with a girlfriend, something that as bad has happened. And it leads to moments of despair. And what do people do? They reach for the most available items. And if they try to hurt themselves, say by an overdose, the likelihood that they're going to die is about 2 to 3%. However, if they have access to a firearm, the likelihood of death is over 90%. We actually just completed and published a study last year that when we looked at the mental health diagnoses of youth who die by suicides, when it came to hangings or overdoses, the vast majority of them actually had known mental health problems. When it came to the suicides by firearms, only about a third. Just kind of speaking to that situational type of things that are happening, as well as the notion of it's about access, and we can change that.
Eric, are there socioeconomic, racial, or gender markers on the suicide numbers?
There are very clear for all of those when it comes to suicide. So globally, when you look at firearm suicides in the United States, the highest risk group is actually older white males starting around age 65 and older when we see the highest rate of firearm suicides, which is absolutely unequivocally an access issue. That is the group with the highest rate of gun ownerships in our country. When we talk about poverty, I have done studies and others have done studies that show unequivocally higher rates of poverty are associated with higher rates, particularly of firearm homicide, although suicide also goes along with that. You see about a 30 to 40% increase in firearm suicides in areas with concentrated poverty versus those with less poverty.
And let's talk, both of you, please, about social media and how social media use, and I'm talking now about the 19 and younger group, are impacting on these numbers. Sandy?
I think that also comes back to, as Dr. Fleegler was explaining before, when you think about youth and that impulsivity, and when you think about children who are utilizing social media and they're having those bad days, especially when you have these posts that come out that are rather negative to children, and the cyberbullying that has continued to increase over these last few years. And how do children respond and react to cyberbullying? We've seen a dramatic increase in cyberbullying overall. We've recently released a report through the Baker Institute on HISD and the incidences of cyberbullying among children in HISD. That has been high reports of cyberbullying. And when you think about how do children respond to these things, sometimes children don't have the means and the ability to know how to respond, and that's impulsivity, that response and that reaction that they have. And it's, oh my gosh, my life is over because of this post or this response that came out over social media, which hasn't been able to happen before. And it's all about access. What do children have access to? And is that firearm secured in the home? In the state of Texas, along with 26 other states, there are child access prevention laws, which do mandate that the firearm owner is supposed to secure the firearm and not allow those that should not have unauthorized access to be able to reach that firearm. But that's not all states. And also, who is going to be responsible for making sure that firearm is secure so that people do not have access to it?
I think we're still trying to understand the relationship between social media and mental health problems, especially among youth. But there's no question the rise in the mental health problems over the last decade, in particular around the rise of social media use and its effect on communication skills and everything else, has been enormous. And I'll illustrate it by what was truly one of the more shocking experiences of the past decade in pediatric emergency medicine. So I spent the first 25 years of my career at Boston Children's working in the emergency department. And if you go back 15 years ago, it would be very common in our 60-bed emergency department to have a couple of kids who were there with suicidal thoughts and working on mental health and getting them connected to mental health institutes to kind of get them their therapy. If you went back 5 years ago, there are times when those 50 to 60 beds were more than 50% full with children who are having suicidal thoughts and unable to get access to mental health care. And it was just stunning. And it changed the dynamic of these relationships. And so this overwhelming nature of both, and this is not unique to Boston, this is across our entire country, the overwhelming nature of the mental health problem has dramatically changed with the rise of social media. Its direct ties, I think we're still trying to understand, and it's certainly not just that, but it's been a huge problem.
Eric, I just had a conversation a week ago with a senior official at one of TMC's major health institutions discussing the observations made during rounds of the emergency room. This is all pediatric, and the number of beds occupied by behavioral cases was stunning in this individual's experience. So it's a validator of what you just said.
We talk amongst ourselves, of course, across institutions in the United States. The numbers are extraordinary, and the research is bearing that this is not kind of one-offs here and there. It is a catastrophic problem for our youth.
Okay, it is a catastrophic problem. The former administration's Surgeon General declared firearm violence a public health crisis. The numbers show the trend lines. They're not good. So, public policy, Texas, the nation. How do you begin through public policy, statute, regulation to be able to deal? And of course, Sandy, Eric, this is what you do in the Firearms Injury Prevention Safety Program. What kinds of policies work better? Texas does have regulations. Are there changes that could be made that would improve the regulations? And talk a bit about the chain of custody. The manufacturer, initial point of sale, resale, owners. Where are the requirements in law? Where are the penalties for failure to abide? How can it be done better? Or in those states that don't have regulations, done at all?
Well, I think the single most modifiable risk factor for firearm injury is access. And I think that's one thing that we don't necessarily talk enough about. When we think about firearm policy, we have to think about how people get access to their firearms. The Second Amendment is the Second Amendment. And I think we address that. At what level are we going to approach this? And one way that we talk about access is how do people secure the firearms? As you know, with every handgun purchase, there is a secure device that is provided with those. But what type of secure device is mandated with that? Is it appropriate for that? Is it appropriate for the firearm owner? Does the firearm owner even utilize that? There's lots of different layers that we're still unpacking and determining for the firearm owner because, again, it all comes down to access and making sure that unauthorized users do not have access to that firearm. And also understanding that at some point in the continuum, that firearm owner themselves may become an unauthorized user themselves, especially when you think of suicidality. So I think understanding the terms of access and making sure that people should not have unauthorized access to that firearm. Child access prevention laws are not universal across the United States. There's a huge opportunity there for us to look across the country, having child access prevention laws. There's been federal legislation that has been introduced looking at how we can put that as a floor from a national standpoint. I think looking at age purchasing laws, there's lots of variations around at what age you should be allowed to purchase a firearm, whether that be 18 or 21. I think there's strong arguments to be made around 21 is the age for purchasing handguns, but every state has a different age around long gun purchasings. There's a lot of good arguments around at what point is their frontal lobe being appropriate for purchasing of a firearm versus that supervised access between 18 to 21 if you're in military or if you're in sports use. So there's several layers to be talking about when we're thinking about firearm policy. But again, it comes down to, from the point of view being a firearm owner, is making sure that access, because that's the risk factor that we can modify.
Sandy, for our listeners, how's Texas doing?
So as far as from a policy standpoint, we're not the worst. And I think that's where the misnomer is. I think people are like, oh, Texas must be terrible. We actually do have fairly good laws. We do have child access prevention laws. It is a Class C3 misdemeanor if a firearm is accessed by a child and it is readily dischargeable. So if it's a child who's under the age of 17, you have to be 21 to purchase a handgun, 18 to purchase a long gun. We do have permitless carry in the state of Texas, but we're not the only state. There's many other states across the country who also allow permitless carry, so we're not unique in that sense. But as far as if there's a mental health concern, if you have been admitted to the hospital for a mental health concern, you do have to report that to the National Instant Background Check System as well. So there's several restrictions on where you're allowed to carry as well. So when you think about rankings for strength of laws, I believe we rank right around the middle of the pack for the country. So we're doing okay, but also from where the opportunities are, we do have opportunities to strengthen our laws to ensure that we have access improvement there too.
And where would that improvement be most useful?
Again, I think we have some opportunities to improve our child access prevention laws. It only instigates if you're under 17. So for those who remember the Santa Fe shooting, which was one of the mass shootings that occurred in a school, the child had accessed their firearm from their parent, but the child was 17, and therefore the child's parents could not be prosecuted for not properly securing their firearm. There's opportunity to allow for that. So if it were under 18, that would have been an opportunity to make sure that we could have parents be held accountable if their child does access their firearm. And then also looking at raising the age of firearm purchasing for long guns from 18 to 21 that has been repeatedly called upon in the state of Texas. We've done multiple surveys out of University of Texas, and it's been widely accepted among Texans, including firearm-owning Texans. Over 70% of firearm-owning Texans have said that they approve and agree with increasing the age of firearm purchases for long guns, especially for semi-automatic firearms from 18 to 21. Especially increased after the Uvalde shooting as well. And the advantages to doing that would be you can make a response, especially after an incident like that, but also you could potentially see among homicides and suicides. There's opportunity there. There's also political will among the population. So I think that would be something that you can advocate for.
Eric, your background has been at Mass Gen and area hospitals. I want to lift this issue just as Sandy said. If this is not a Second Amendment question, it's about safety of storage, safety upon purchase, safety upon resale, and appropriate regulations and penalties to make users and access issues less susceptible to those momentary pressures that produce suicide and homicides. Tell me about Massachusetts. What's the environment there? What's the trend line look like in Massachusetts?
These are really important questions, and understanding variability among states, not only in the fatalities and injuries, but how it reflects policy. It's this laboratory of understanding what has potential value. So in Massachusetts, from a legislative perspective, the breadth of legislation, the types of legislation were pretty much considered among the top in terms of strength of legislation. Us, Hawaii, California would really kind of be the states with laws that are considered the strongest. And likewise, in Massachusetts, we pretty much have the lowest firearm fatality rate in the United States. Now, that's a reflection of many things, and you have to make sure to tease apart the nuance. In part, we are, from a gun ownership perspective, one of the states with the lowest firearm ownership rates. And as Sandy has said, and as we realize, if you want to know where gun fatalities are going to occur, look where the guns are. That is an unequivocal relationship. How people own them, why they own them, how they store them, that is where we can really play around and make a major difference. So when it comes to child access prevention laws, which Sandy was alluding to and you've already brought up, there are variability in how they are enacted and how they're done. We did a study looking at across the country at what happens with child access prevention laws. There are a set of states that have passed what would be considered laws in this category, but they're called recklessness laws. And these are ones that say, hey, if I, the gun owner, hand a loaded gun to a child and that child then hurts somebody with said loaded gun, I could be held responsible. It's actually, to me, almost a remarkable thing that you have to pass a law that says that's the case. And it turns out those laws don't do anything because they're kind of a duh type of law. But the laws that actually reflect you need to lock the guns up, you need to prevent them from accessing them or even potentially accessing them have shown they reduce firearm fatality rates in these kids by 14% at a baseline. And with states with the strictest laws, the ones that say even if they could hypothetically get access to them, you could be held responsible, they can cut those fatalities by 50%. And that's what we have in Massachusetts. When it comes to domestic violence laws, the laws that mandate the removal of guns from people who have domestic violence misdemeanors at the state level have been shown to reduce firearm fatalities among women and domestic violence by 14 to 20%. The ERPO laws, or the extreme risk protective orders, the red flag laws, are showing good promise in terms of especially around suicides and perhaps even with mass shootings reducing fatalities. California has really shown that with mass shootings, it's probably reducing them. And in studies out of Connecticut and Indiana have also shown that. And again, these are not just red versus blue states. There is a mix of laws, just like in Texas, that can happen. But there's more we can do. The Consumer Product Safety Commission, which is what regulates every single thing in the United States for the safety of that device, your car, your hair dryer, whatever it is, the only thing they don't regulate for safety are firearms, which is a stunning thing considering the entire purpose of a firearm is to cause some sort of injury, whether it's to an animal or whatever else you're using it for. And in that context, that's part of the reason why we see unintentional fatalities among 2- and 3-year-olds who should never be able to pull a trigger and accidentally kill themselves or somebody else, But because there's nothing that regulates them for safety, that's what happens. And so there are so many things that could be done. But I think you started this whole question with a particular statement about the Surgeon General and their report about talking about gun violence in the United States as a major problem. Well, that was a huge milestone to get that report out in 2022. But unfortunately, one of the first acts this administration did was strip that. That report is no longer available from the Surgeon General. And so while there are so many policies that could move us in the right direction, we have seen in the last 117 days of this administration a reversal of so many things related to firearm safety that it's quite threatening to the health of our nation.
Sandy, back to Texas. What is the policy environment in Austin right now? That's some of the specific steps, shifts in age limits, long gun purchases, tightening up some of the regulations that are already in place to move Texas from that middle tier to an upper tier.
It's a difficult environment sometimes in Texas to move firearm policy. Typically, after mass events, what you'll see is a loosening of firearm restrictions, and that's been historically the response of Texas. So you'll see lower restrictions on firearm ownership or less restrictions around firearms in general, and that's been how Texas tends to respond. It's the response of if there are bad guys with firearms out there, then you should get good guys with firearms out there is the response, and that's well documented in the history. Currently in Austin, as far as what bills are moving, bills that are related to raise the age are just not really moving very much right now in the Texas legislature. And that's not unsurprising. It hasn't moved from the previous legislative year, and even immediately after the Uvalde shooting, that didn't really move very much. So it's very difficult to kind of move the needle. Some current legislation that has moved, one that is involved in trying to reduce firearm suicide, has been trying to increase the amount of temporary out-of-home storage options in the state of Texas. So as across the country, there are multiple options of what's commonly referred to as gun shop projects, where if a firearm owner needs to store their firearm temporarily out of their home for any reason. Maybe they're moving. Maybe they are having guests over at their house and they don't have adequate storage space. Or if someone in their home is having a mental health crisis and they need to just temporarily get the guns out of their home. This is a voluntary option for firearm owners. There are firearm retailers that can store firearms for them, and this tends to be a no questions asked. They don't even have to tell them what's going on. They can just say, we just want to store our guns here for a short period of time. It's across the country. Multiple states have these. And in the state of Texas, we have several firearm retailers across our state that offer the storage process for firearm owners. But what the concern is we would have a lot more that would continue to offer this process, but the firearm retailers are concerned about liability protection from two perspectives.
Sandy, let's unpack the interests for and against tighter regulatory control for safety purposes in terms of long guns versus handguns, 18 versus 21. District attorneys, chiefs of police, I think your experience has been strongly supportive, overwhelmingly supportive of enhanced regulatory measures. Is that right?
Absolutely. Yeah. And I think the general overall is that people do want to have that increase, raise the age from 18 to 21. There's strong support from district attorneys, strong support from lay people, strong support even among firearm owning community, from firearm retailers. We've seen even from firearm trainers, range safety officers, et cetera. So
there is not an industry, manufacturer, retailer bias against those changes.
So certainly among the Uvalde hearings, what you heard was from, of course, NRA came out and officially made their statement that they were opposed to raising the age from 18 to 21, and that was officially on the records during the hearings. Manufacturers have not come out, as far as the ones that make the firearms have not come out in an official statement one way or the other, but that's where that came out officially from. I think concerns were raised from the perspective of, what about people who are youth that do shooting sports? What about youth that enter the military? But again, the perspective from the legislature is those are supervised activities where you have someone who is watching you with your firearm. And so those are kind of carve-out activities, and they're not someone who's individually purchasing that. So there are opportunities to allow a carve-out in that legislative process for supervised shooting activities.
Sandy, how does the NRA justify that position taken after Uvalde?
that was the position of their leadership and their membership, and that they are not wanting to infringe on the rights of firearm owners from the Second Amendment.
And Texas legislature, Austin, if there is broad support amongst the various communities, including gun owners, for these kinds of changes, where's the opposition?
From my understanding among the legislatures, I think some of it is wanting to make sure that they are meeting the needs of the general people. We have just not seen a lot of movement in the committees. And so a lot of this is getting the legislators to bring it to a hearing, bring it out of the committees, get movement.
I wanted to offer a non-Texas perspective real quick. So every year or two, Gallup polls, Pew polls, New York Times do large-scale 2,000, 3,000 surveys of gun owners and non-gun owners about firearm legislation as means of kind of protecting people. And what is so amazing every time is that not only a majority, but a large majority of the non-gun owners and gun owners alike really support what is kind of colloquially referred to as common sense laws. You know, these laws that talk about child access prevention, these laws that talk about ERPO, these laws that talk about age, broadening universal background checks, all of these laws, the gun owners themselves support these, and they support them in large numbers. And I think Texas, like so many other parts of the country, it's a bit of the tyranny of a small vocal minority that have political sway that is affecting kind of whether these laws get passed or not.
And I can remember in the not all that distant past, when the NRA was one of the strongest advocates for regulation and safety provisions and training for all forms of firearms. They were out in front of the pack on this.
They helped write some of the most important legislation at the federal level in the 60s and 70s around firearms because they recognized that they wanted their gun owners to be like a responsible part of society and to have a say. And it was really in the late 80s, early 90s that they started to move in this direction of a financial mindset. And at all costs, they were going to protect gun owners, quote unquote, with very little say in what the actual people wanted.
But I will also say, though, like this current legislation, not a lot of legislation is moving, because even when we think about like our temporary out-of-home storage legislation, the way the bill is written is that it protects firearm retailers, grants them civil liability protection if they provide temporary out-of-home storage. This is very pro-Second Amendment, but also is aligned to help reduce firearm suicide in the communities. And that bill has stalled out in the Senate and has not had a hearing in the Senate for now 20 days. And we're almost at the end of session and it hasn't moved. And this has got bipartisan sponsorship with some of the most conservative Republicans as co-authors on the bill, and yet has not moved. So I think also you're dealing with a climate of people who are just nervous to pass firearm legislation, whether it be pro or against firearms. And this is kind of the climate that we're dealing with right now in the Texas legislature.
Sandy, 3 people in Austin: the governor, the lieutenant governor, the attorney general. What are their positions on this?
As far as just in general around firearm legislation?
Around the specific, careful modifications to existing Texas regulations to improve safety and access.
I think they've been very clear about how they want to make sure that we can improve the health and safety of Texans, investing more in mental health. They've done a lot to spend significant amount of dollars in improving mental health, around hundreds of millions of dollars being invested in student mental health, but not as much on specifically moving the needle around firearm-specific legislation.
Have they actively opposed?
I've not seen active opposition, but more along the lines of diverting funding into the mental health access, which is sorely needed in the state of Texas.
Final comments. Eric?
I think it is important to recognize that nobody wants their kids, their spouses, their family members to die by guns. It doesn't matter what your racial and ethnic background is. It doesn't matter whether you're poor or wealthy. It doesn't matter where you live in the country. And that these firearm policies are something that we can make a huge difference with. But we need the laws, we need the regulations, and we need to kind of reconsider, is our priority to just make sure that we get as many guns owned out there when we have already 400 plus million guns in our country? Or is our priority to make sure that people are safe? This is a very commonly compared theme to like safety around motor vehicles. You certainly and I came from a period where seatbelts weren't regulated, certainly decades before airbags came out. And there was always the same type of statements made when these new innovations were put forward. They're going to cost too much money. People don't want them. And basically, the federal government said, these have been shown to save people's lives. We're going to put them in place. And now we wouldn't even think about the idea that we shouldn't have airbags in our cars, the things that are safer. We haven't taken away the cars. We don't need to take away the guns, but we do need to make policies that are going to make people safer.
Sandy?
I think one of the things that I like to remind people of is the greatest threat to gun rights is gun violence. Every time someone dies by firearm, that threatens someone's rights to have their firearm. And this is a collaborative effort here between firearm owners and non-firearm owners to say that we should prioritize how we address firearm injury and firearm death in this country. Because everyone, as Dr. Fleegler said, everyone wants the same thing. Nobody should die by a firearm. But that doesn't mean that we need to eliminate firearms in this country, because everyone should continue to have their right to own what they want, but nobody wants people to die by firearm. With strong policies that are evidence-based, informed by the science, we can make sure that we reach the same goal, which is not having people die by firearm, reducing those injuries, reducing those suicides, the homicides, but utilizing the right evidence to make sure that we inform the policy. And that's really where we need to be and where we need to keep our focus at.
And we need research to understand whether these things make a difference or not. And that
absolutely
takes funding as well.
To recap, this is not about the Second Amendment. It is a way of trying to improve on a statistical, epidemiological basis the safety of all Americans who own guns, who live in and with and in the proximity of those who own guns, especially children. And that's not something that ought to be a red, blue, or partisan political case. You can argue the Second Amendment. That's not what this is about. It's about health and welfare. And there are ways to do it better, and there are ways to do it not so well. And our hope is that by looking at the numbers, the facts, the evidence, we can articulate a path forward for Texas and for the nation, because this is, as you have both pointed out, by no means a Texas unique issue, nor is Texas in the worst of places as one looks at the country. I thank you very much for the work that you do and for your contributions today. Baker Briefing is brought to you by the Baker Institute for Public Policy, which provides meaningful, nonpartisan policy analysis on the most critical challenges facing the United States, Texas, and the world. This episode was produced by Karina Zamel with support from Ira Matondon. AV production was led by Kevin Young. Be sure to visit us at bakerinstitute.org to learn more. Thank you for listening.